We want to talk about the use of drugs and prescribed drugs in Ireland now on the programme, because News Talk has learned that 3 million prescriptions for mental health drugs were written in the country in 2013. Nearly 1 million scripts were for benzodiazepines and nearly 2 million for antidepressants. And 2013 is the latest year for which these figures are available to us. But in the same year, almost 400,000 illicit sedative drugs were seized, a 150% jump on 2010 figures. And as we showed on the programme 2 weeks ago, it's also possible to get prescription drugs which should be prescribed by a doctor illegally over the internet, because benzodiazepines and Valium was one of the drugs that we managed to bring into Ireland without any check whatsoever. So do we have a growing dependency and a growing problem on medication? Well, to discuss this with us in a moment, Maureen O'Sullivan, the independent TD for Dublin Central. Maureen, how are you? Good morning.
Good morning, Chris.
Maureen, is this a problem that you see manifest itself, people who are using benzos or other drugs?
It's a very, very serious issue in the inner city, and it's one where the projects and the services are under increasing demand. And what we're seeing happening is some of these tablets are appearing in printed packaging. They're likely to be counterfeit or rejected batches. I would like to acknowledge the community projects, the drug projects, the youth projects, the ones I know. And yes, it is, addiction now is a national problem, but I just talk about the ones that I know in Dublin, in the inner city, and they are doing absolutely phenomenal work in terms of addiction and in terms of supporting people into recovery. And there's nothing as enlightening and as positive as when you talk to people who make recovery and the difference it makes in their lives, in the lives of the people who love them, in their communities, and in terms also of what they give back to those who are still in addiction. There's no doubt equally that these issues are very, very low down the priority scale when it comes to government and policies. And what we see is a lack of keeping up with the drug situation. You know, it took so long to cope with heroin that by the time the methadone protocol came in, there was a different drug of choice. And there's no doubt that there's a very slowness in terms of dealing with these tablets. What we're seeing also is increasing polydrug use. So these benzos, these drugs are being used with other combinations that have not been chemically tested. And you throw alcohol into that mix as well. And it's leading for really chaotic behaviour and difficulties for those who become addicted to these tablets.
And Maureen, I'll just add to that, it's also leading to crime, because I've been at more than one murder or manslaughter case in which benzos and alcohol, the mixing of them, the psychotropic effects were just unprecedented, and actually there was medical evidence saying that this was a factor in why such violent crime was taking place.
Absolutely, and we do know that they've also been a factor in drug-related deaths. And this is all of this dealing and obvious use of these tablets is going on in communities where, you know, young children are going to schools and they're seeing this and they're seeing the dealing going on and they're seeing the effect on people. And the other aspect to it is that it's a very lucrative business for those who are selling these tablets. And this is why, you know, projects in the inner city are calling for the mini cabs type operation, which would target those low-level dealers. And I mean, if the big guys don't have somebody to sell for them on the ground, well, then that's cutting off a chain of command.
With this, I suppose, is there an acceptability that has crept in that if you inject a drug like heroin, you are a drug dependent, you are a drug user, and maybe people who want to be even more dismissive, you are a junkie. But if you take pills like this, if you like, helpers, benzos, you know, Valiums, that isn't the same thing. Has that type of attitude crept in?
No, I think that was probably an attitude that you saw with cocaine when it appeared, that it wasn't, you know, a real sort of drug. I mean, I just hated that term recreational drug use that came with cocaine. But can I just mention one other point, which is on the recovery aspect, that if somebody addicted to tablets wants to access residential detox or residential treatment, they have to try and bring themselves down from a very high number of tablets. And that's proving, you know, very, very difficult. So because that is the attitude for the rehabilitation, residential rehabilitation, it's slowing down the recovery process for those who want to get off the tablets.
Maureen O'Sullivan, TD, the independent TD for Dublin Central. Thank you for your time this morning.